Welcome to Accessibility Ease with Wine and Cheese, where you'll often hear me tell cheesy jokes and sometimes hear me whine about digital accessibility.
All right, so we're here today with Simone Chan, and she has a very interesting career. And one of the things that she has been doing is starting her own business. And this business is around art therapy and traumatic healing. So, what I might do is I might just throw to Simone, get you to introduce yourself and to tell us a little bit about your business.
Thanks, Kylie. Hi, I'm Simone Chan. I'm an art therapist and somatic experiencing practitioner. Art therapy is my postgraduate qualification, and it's the main modality that I work with. And I also work with somatic experiencing. So it's like using our body to help us regulate and to process any trauma that may be, like unresolved. And art therapy gives us the opportunity to use art materials to express and to touch into some of the subconscious pre-verbal trauma states. And through the art making process, and then after that, I will guide the clients to reflect on what they have done and their process, and we can heal from trauma in that way as well.
I myself, I'm a bit of an artist, so some of the paintings that are behind me are, my own artworks. And I find that when I'm painting, I kind of get into this zone where everything else kind of disappears. So I'm wondering for your clients. So I know you look at people that have neurodiversity or complex trauma. And I myself, if people have been following me, know that I have CPTSD. How do you find that you introduce these concepts of artwork and help them to get through, and communicate some of the things that they've been struggling with?
Yeah, so typically our session would start out talking. So sometimes the client might talk a bit about something they might like to process or might like to explore. And then maybe I will guide them to use the art materials to express how they are feeling, or maybe express, like, basically I can give a directive, but often it's up to the individual and whether they want to follow the directive or like come up with their own stuff. So oftentimes it comes up on its own naturally. So it's a very like intuitive and instinctive way of creating, and in that liminal space, in that it creates like you said, in the zone, right? So
Yeah.
when you are in the zone, it kind of, we get into the creative flow, and we're kind of like in a different head space from a very conscious and cognitive a cognitive way of thinking, and it's more of like a sense of play, bringing play into the therapy, and using the art materials in a very like instinctive way without having to think too much. And it kind of gets into the pre-verbal or subconscious states of our mind and body.
Okay.
To help us explore what's actually below the surface, and it helps to bring that up to the surface and externalize that, so we can talk about it afterwards. Like, and after we do the processing, we do the emotional part, we are in a better place to make meaning and to talk about it like cognitively. So there's a body and mind connection.
Yeah, so is it a little bit like meditation? So it's not going as far as meditation, but it's helping you get into that state. And, with meditation, sometimes you'll have sort of intrusive thoughts come up. Is that kind of how you see the process working?
Yeah, I think what you mean when you say meditation in this case, I think it's kind of like mindfulness, and when we are focusing on ourselves and just sitting with ourselves and sitting with what's happening in us, and then that's when the so-called intrusive thoughts can come. And it's basically just setting aside a space for us to be contemplative and like reflective, and be more mindful of what's happening inside us. And that's how I think some of the like subconscious stuff surfaces.
Yeah. And when that happens for someone, would, you said that you give some direction and they can choose to take it or not. If they're expressing that they felt, these feelings, some of, like I said, the intrusive thoughts that they weren't expecting to come out, is that kind of how your direction leads them to express that through art, or do some talking therapy, or a little bit of both?
Yeah, I mean, it depends on the individual. So some people, they might come in, they already know what they want to make with the art. So I can just leave it to them, and but of course I will also guide them along. And it depends. Like some people like to create and then talk about it, but some people like to create and talk at the same time.
Mhm.
And some people might ask me, uh, oh, I want to talk first, and then can you guide me on what I should do with the materials? Yeah. So it's really person-centered
Yeah.
and client-led.
Yeah. And I think that's great. A lot of I've been to quite a few different therapists, and it's really important to find one that gels with you, and that can help you in that way. So it's kind of, if if you see someone and they just get you doing talking therapy all the time and it's not working for you, then I think this is something that people should consider, because it's something that's, well, correct me if I'm wrong, but it's something that feels fairly new, or it's just getting communicated more these days. Because, back when, 10 years ago, when I was going through a divorce, really the only option I had was sort of a talking therapist or counselor. There wasn't really other options that anyone advised me about. So have you seen that? Is this kind of a new trend in, mental health?
Yeah, yeah, I mean, I'm sorry to hear that, talking therapy was what was available to you then. And it's true that we are becoming more aware, or there's like more knowledge of how trauma resides in the body and how the body remembers. So there are more like mind-body therapies nowadays. Other than art therapy, somatic experiencing, there's also like EMDR,
Mhm.
and play therapy, sand therapy, and there are also like more body focused modalities like craniosacral therapy, which I'm also receiving training in at the moment. So that's like a form of neutral and light touch that can bring about
Okay.
healing in the body.
Oh, okay. So physical touch to help you with healing.
Yeah,
Yeah. Oh,
yeah.
very interesting. Yeah, I haven't heard about that one before. I have heard EMDR. This year I actually started on that. So previously I was kind of able to put my emotions down, and then had a big incident at a workplace, and unfortunately that then sort of broke the barrier. It's almost like how people say, you have this bucket that's filling up, and it's all okay, and then one day you get that drop that just unleashes it all. So I kind of had that happen, and I started the EMDR treatment. And that's why I've been looking for things that, are a little bit different, because the talking therapy didn't work. And that's why I was really excited to meet with you today, because, I do have an artistic nature, and I just don't use it enough. But when I do, I find that it really helps me just focus and let go. But having someone to sort of guide you through that process, like you do, I think would be, yeah, really beneficial. And I can see where it would be beneficial for others as well.
Yeah, thanks, Kylie. Yeah, I think a lot of it is also, it's important to note that a lot of it is invitational. So it's like we often invite the client, but it's up to the client on what they would like to do and whether they want to take on that suggestion.
100%.
Yeah,
Yeah, yeah. Give them the power, essentially,
yeah,
because I guess when you are dealing with people with, trauma and complex trauma, often they feel powerless, and they don't have, that ability. They don't feel like they have that ability to make their own decisions.
yeah. I mean, I think you're totally right about giving the power to the client, because like when they are wielding the brush or the crayon or the pen or whatever, it is basically the client creating their own self, right? Their own future.
Mm,
So
mm.
I mean, a lot of times like trauma is kind of like can be a huge part of our identity. And you
Mm.
know, when we process the trauma, it's like what next? Like you might feel like, you know, you're personally linked to the trauma, or like your identity is actually a huge part of that is a trauma. So
Yeah.
it's also important to like create a new self in a way, create what you want to be. And by using the materials, it's very client led, and it's not like I'm telling you what to do. And so I think that that also reduces the power differential between the therapist and the client.
Definitely.
Yeah.
And I imagine for clients, it probably feels a little bit more welcoming, because it's not like you're having someone that, you know, sometimes you'll sit there with, you know, a psychologist or a psychiatrist and it feels like they're ticking boxes, you know. But it sounds like it's much more of a journey with you, and you could almost feel more like a friendship, you know, rather than just a professional giving you assistance.
I mean, I hope so. I hope to create a kind of, you know, therapeutic relationship. And I think that therapeutic relationship is the main healing, the thing that drives the healing, like, because it's psychodynamic and it's also healing the relationship trauma, right? So a lot of
Yeah.
it is about the therapeutic relationship. Yeah.
Yeah, for sure. And you specialize in people that are neurodiverse. Do you find, because obviously you'd have clients that come from all walks of life, all different backgrounds. Do you find there's a significant difference between, you know, working with someone who is neurodiverse, who might have autism or ADHD, or, you know, CPTSD is also considered neurodiversity, which people often forget, you know, versus someone that, you know, may have gone through a specific incident, or, you know, that they really need to work through right now, rather than having, you know, neurodivergence. So, you know, someone going through a divorce, or, you know, someone involved in a car accident, or having something, you know, sort of a one-off incident. Do you find that you work differently with both groups of people?
Yeah, I think there is quite a big difference in how a person behaves and communicates, whether they are neurotypical or neurodivergent. And I think the main thing is that, an important thing to remember is that neurotypical people, um, they have more like community support, and maybe they have fewer like less complex trauma, because I think a lot of neurodivergent people would naturally have more complex trauma, because like living in a society that is not catered to their needs. So I think neurodivergent people have less support, less resources, and so, and also with the complex trauma, like it's kind of like interwoven in everything. And yeah, it's like one thing is attached to another, and then attached to another thing, so like it's like much more complex. And it's like a web of different like traumas, like to say.
Yeah.
I mean, but that's it. I think I do work well with neurodivergent people, because I think you might be aware with the double empathy.
No.
Yeah.
What's double empathy?
So double empathy is basically how people of similar neurotypes or similar experiences are able to understand each other better. So neurotypical people can understand and empathize with neurotypical people better than a neurotypical and a neurodivergent person.
Yes, for
Yeah,
sure.
whereas a neurodivergent person can empathize with other neurodivergent people better
Yep.
than with a neurotypical person. But of course, this is also a generalization, and there might be like
Of course. Yeah.
individual differences. So somehow I just found that such clients, like neurodivergent clients, like naturally gravitated to me. And
Yeah.
that was even before I found out about my own neurodivergence. So the more
Right.
I worked with, yeah, like it's quite magical actually. And like to meet all these people through my practice, and then as I'm helping them, I'm also learning about myself, and I'm realizing like, hey, actually, this like resonates a lot for me. And I eventually found out about my own neurodivergence. So of course, I think you mentioned that it's important. What's important is also the rapport between the client and the therapist, right? The rapport, like how well you
100%.
get along.
Yeah.
So I do have people who, you know, they come for one session and I never see them again. And that's totally fine because, like, you know, we have to be professional and
Yeah.
not take it personally. But
Mm.
there are also people who they come and like they just keep coming back and they find that it helps them. So I'm just happy to be
Fantastic.
able to help whoever I can and wherever I can. Yeah.
Yeah, definitely. And yeah, it must be hard in those situations where you do have a client come in just the once and you don't know, because sometimes you don't know whether it's this that you and them just didn't click, or whether it was, you know, that the person didn't have the motivation, or, you know, and I guess that's one of the difficult things I imagine when you're working in this space, is that sometimes people want help but they don't have the ability to seek it. So, you know, if they're suffering from depression, they might finally get themselves to see someone, but then it can just become overwhelming and too hard for them to come back. So I just imagine that's got to be really challenging.
Yeah, I think there are just so many reasons and so many conditions for a person to get help and to continue getting help. So there could be many reasons, and I think it's just part of the job that I have to deal with the fact that, you know, I might not be the right therapist for everyone, and that's totally fine. So I have to like process my own issues and my own concerns like with my own therapist. Yeah.
Yeah. And in that, how do you look after your mental health? Because obviously things that come up from your clients, you know, can be very traumatic. And, you know, anyone in this industry is highly empathetic. So if, you know, if it starts to wear on you, if you've seen a few different clients in the day and you've had to really deal with that heavy material, what do you do to relax and, you know, to put that away?
Yeah, I think being self-employed does help so I can schedule my time accordingly and not like overload myself.
Yeah.
And it's also important to have boundaries like with our clients and um you know to give the signal and to communicate that, you know, it is a professional relationship and it's not like, yeah,
Yeah.
there are boundaries around that. So it in a way it protects me, but it also protects the client, you know, from being like overly dependent on me. And I think it's remembering that I'm not there to like rescue or to save people. And I think
Yeah.
that's very, very important so that the client can also rise up and, you know, come up with their own ways to help themselves. Because I think people often underestimate how resilient and resourceful people can be when they're given the chance to also do their part in their healing process.
Yeah,
And
definitely.
I think getting back to your question about what do I do to care for myself. So I think having personal therapy helps. And since our training in art therapy, we are it is a part of our course requirement that we have to go for like 30 sessions of our own personal therapy.
Oh, okay. As part of your course to, you know, get
Yeah,
accredited, you have to do that?
yeah. So
Yeah, wow.
it was like 10 sessions per semester that we were also doing an internship. So we
Okay.
did an internship for 3 semesters, so that would be a minimum of 30 sessions. But of course, I also continued therapy after that to
Mm,
continue supporting myself. So I think this will resonate with many therapy trainees
mm,
in that going through the course can often be traumatic because like, it brings up a lot of
yes.
our own stuff. But I think that's also part of the process because like we have to deal with our own stuff and learn how to deal with that so that we can learn how to work with other people. So um, I'm really happy for this journey because like it enabled me to heal a lot of my own traumas and to kind of find myself, find my own identity, which I previously I might have been like subconsciously masking. Yeah.
Mm.
And also of course other self-care practices like, you know, exercising, I go for
Mhm.
yoga, being in nature, being in touch with nature, that's really important for me. And I think I think the exercise really helps. Like
Yep.
it's
Gives you that
instantly,
endorphin boost.
yeah, like it boosts your mood indeed, immediately. So yeah.
Yeah, for sure. No, I had no idea. I went to uni. Some of my close friends actually went into psychology, and when you ask them why they were going into psychology, a lot of them said the same thing, that they wanted to figure out, and to quote them, they wanted to figure out what was wrong with them. And I kind of told them, there's nothing wrong with you. It's just you need to understand yourself better. Because same thing, they were often undiagnosed with autism or ADHD. And so as they were going through, I had these really interesting discussions with them. We'd be there at the uni bar, getting lunch, and they'd be like, "Oh, I read this today, and it just really resonates with me." So I think it's really great that you have to go through counseling and psychologists to get your degree, because otherwise I think it could just really open up and not give you a chance to move past your own trauma.
I'm also an artist, so as something else that I do. So I also create like paintings and some zines that I've made. Yeah.
Do you want to show us some of your work?
Okay, thank you so much. Yeah, so I illustrated some of these books on fables, like animals. So there's like the otter, and I mean, yeah, this is Singaporean fables.
Okay.
Yeah, for children. And then I also illustrated this like cover for a book on eco poetry. Yeah, and then these are the more personal ones.
Yeah.
Like this one is about a comic about a girl who lived with eczema, and so there's like her experiences, growing up with eczema and like going to school. Like
Oh, it could be so tough. Yeah.
yeah, so the social aspect of yeah, like being in a girls' school and like being bullied for having eczema. And then this was quite some time ago. I think like more than 10 years ago I made this, and this one is called Delulu Lemon: Confusions of a Lemon in an Orange World. So it's about like being different, and
Yeah.
and
I've
yeah,
I've
this
got I've got some friends, children that I think would love that. Because a lot of the parents as well find it really difficult to understand how they have to change their parenting if they've got, one child that's neurodiverse and one child that is neurotypical. So does that kind of walk through how the person feels in
uh
that book?
I mean, it's kind of semi autobiographical, so it's kind of like based on my own experiences, some of it. So yeah, so there's it's kind of like through the lens or through the perspective of someone who's different. Yeah,
Nice.
like
Right,
a
let us
lemon.
have a look. I want to see that book.
You mean like now?
Yeah.
Okay, let me just go to a yeah. So like this one, like I'm not sure if you can see.
Ah, cool.
So they're lining up
Yeah,
to go into the
the
juicer.
juicer. Yeah.
Yeah. So it fits the oranges, like the whole
Yeah.
of the
But yeah, not a
juicer, but
lemon, no.
yeah. So the lemon has to do a lot more. Like you see, he's like scraping himself with a
Yeah.
with a with a
Yeah, the world's
peeler. Yeah.
a
So
lot more challenging.
yeah, it hurts the lemon to conform to the orange way of doing things.
Yeah,
Yeah.
right.
Yeah.
I think that's
Thanks.
really cool. It's a really good way to put it, in a way that people can enjoy it. It's not too big. That's one of the problems that you get with all of these books. Sometimes you don't have a lot of time, and reading through a giant book can be really, a real struggle for some people. So, and I think that's like illustration is a really good way for people to get information. They say a picture's worth 1,000 words, and I completely agree with that.
Yeah, you just one look and you can get a lot of information out of it versus just like words, right? Yeah.
100%. I love the idea with the oranges and the lemons too, because it's so distinctive, that, you know, anyone can identify that. Anyone can, you know, connect with that. Whereas, you know, when you just hear something that's written for adults that, you know, is, oh, they think differently and they may not understand the wording. It's a lot more theoretical. It's harder to, you know, identify with that.
I think it's just like a really simple metaphor, and it's kind of like distant or different enough to not feel too um like emotionally triggered by it, like, because it's like
Yeah,
fruits, right? Yeah, so it's not like humans, but in a way it's like fun and playful. Yeah.
for sure. And do you sell these books? Are they like available anywhere for people to buy?
Yeah, they are online on my Ko-fi shop. You can get my merch and also my other artworks and prints there. I'm also hoping to join some artist markets in the future when I get around to like figuring out how to join those in
That's
Australia.
it.
Yeah.
Oh, that sounds great. Um, you mentioned that you were late diagnosed, as, you know, as neurodiverse. Did that occur as part of, you know, going through the process of becoming certified, or how did that come about?
Yeah. So I mentioned that we have to go through our mandatory personal therapy for our art therapy training. So I mean, I was healing all that personal like trauma history and stuff, but after that I felt like there was something missing. It's like, you know, I actually became more neurodivergent after I went through the healing,
Oh,
because I
okay.
was more able to be myself, like more authentic,
Okay.
and I actually find out more about, you know, what's actually me and not like people pleasing.
Yeah,
And
so you kind of stop masking as much. So
yeah,
it's
I
not that
mean, like,
it's not that you became more neurodivergent or anything. It's just that you finally could let down the mask. Is that
yes,
what you
yes,
mean?
yes. Yeah, I mean, like, uh, as in at the beginning, I might not have known about it. So it just feels like it's being more neurodivergent, and like it's just like getting more in touch with what what I really am.
Mm, mm.
And I didn't hear about any of this from my own therapist. So a lot of the times it felt a bit like, you know, what's wrong with me? And I often feel
Yeah.
this like kind of feeling from my therapist. It's like, what's wrong with me? What's wrong with you? You know? So but after that,
Mm.
when I went through that, and then I felt like, you know, actually there's nothing wrong with me. Like it's just like this is
Yeah.
how I am. And I later on found out from my friend who got her own diagnosis that, hey, actually this resonates a lot with me. So then I went to read up about it, and I'm like, hey, yeah, this sounds like me. So I went to like find out more about that. Yeah.
Yeah, fantastic. I mean, that's one of the big things too, is a lot of, you know, neurotypical people don't understand about around the masking. So sometimes, you know, people will say something that seems a bit out of place for what you know about them. And it's just because they've kind of let that mask down a bit. And yeah, I think that's one of the concepts that neurotypical people really do struggle with, is understanding that it's not just a quirk, or, you know, it doesn't just happen one day. It's, you know, it's the way that, you know, people who are neurodivergent, how we think, how we feel. And I know from my experience, I mask a lot. So especially since I've really been struggling in the past year, with my own trauma. Things like, you know, being in a room, in a small room with a lot of people, I'll always be standing near the door. It's like I don't even realize I'm doing it, but subconsciously I'll do that because I'm trying to withdraw. Um, because the CPTSD really affects trust. I don't trust my workmates, and if I don't see them for a long period of time, so if someone goes overseas for a month and then comes back and I'm dealing with them in close quarters, I kind of feel like I haven't met them before and I need to rebuild all of that. And I found that, you know, that's something people often struggle with, is understanding, why are you a little bit weird today? As they tell me, it's like, you're a bit off, you're a bit strange, it's not like you. So yeah, I think that's a huge thing.
Yeah, I think because like people often make sense of the world and make sense of other people based on what they themselves are, right? And what they themselves know. So it's very hard to like comprehend something that is different, like on a using a different way of being and way of doing things. So I think and if you are so used to it as a neurotypical person, because like most, like maybe many other people are similar to you, right? So naturally it would be hard to understand someone who's different. So I guess it's just part of just the way things are, that it's hard to understand someone who's different. Yeah. But I guess as a neurodivergent person, like we might constantly be having to accommodate to different way of being. So like we're kind of used to it. Yeah.
Yeah,
So
for sure.
it's in a way we're more used to like accommodating to a different way of being. Yeah.
And a lot more people these days are being diagnosed as neurodivergent much later in life. So like at the moment we're seeing, a lot of women that have gone through all their schooling years, and they've probably been employed for 20 years, and suddenly, that's when they start realizing, a lot of them realize once their kids get diagnosed. Have you had situations where maybe someone's come in for trauma healing with you, and they've kind of then realized that they're neurodivergent, and you've helped them through that process? Have you seen much of that occurring recently?
Yeah, I think it happens a lot. I mean, often people come in with struggles, like, I mean, even things like burnout, difficulty fitting into the workplace, like fitting into social groups, and uh, they may not know that it's because of their neurodivergence. And there's also people who come in for, like, say, family domestic trauma and stuff, and then they realize that he actually I mean, of course, I do see certain traits in them, but because I'm not a psychologist, so it's not my position to diagnose people. But maybe
Yeah.
I might suggest, maybe you might want to read up about this, or like read more about the things that actually neurodivergent people share about, and see if it resonates for you. And then when they read about it, some of them realize that, yeah, actually this does sound a lot like me, and
Yeah.
yeah, they're becoming more self-aware from that.
Fantastic. Yeah, no, that's wonderful. People often don't realize just how much it changes you to finally understand, why maybe you're struggling with personal relationships or with work, and then realize that it's because you haven't been getting the assistance that you need, because you look at the world a bit differently. So it's really good that you can help people with that. When, yeah, sorry, go
It's
ahead.
yeah, I think it's a real privilege. Like, I'm in a very privileged position to be able to do what I'm doing. Yeah.
Yeah.
And I also get a lot out of it. So it's like a two-way reciprocal thing.
Mm.
Mm.
If for example were going to come to you, or one of my friends were going to come to you, what would the process look like on the first day? On the first day that you get involved? Because obviously someone will book with you. Do you ask them questions at the time of the booking? Often, if you go to a counselor or a psychologist, the first session is usually just getting an understanding of the background of the person. So I'm just curious how that would work for you. So if someone, watching this said, hey, this sounds really interesting, I want to meet up with Simone and see what she can do for me.
Yeah, so we do have like an online intake form that I will ask people to fill before they come to the session. So I would have some background knowledge on what they are seeking help for. And in the
Yeah.
first session, it's like an introduction. Uh, so getting to know each other better, so they can also ask me questions, and I will invite them to share more about themselves. like we can start with like hobbies and interests, and
Yeah,
like what are your strengths, because it's good to start with our resources
definitely.
before we go into like the harder trauma
The
stuff.
difficult.
And
Mhm.
yeah, sometimes people will come to the session like ready, like, hey, I want to share about this. I
Yeah.
want to go right into the trauma processing. And
Wow,
uh,
that's got to be hard.
it actually happens a lot, because like people are holding it in, and they're like, I can't wait to like share this with someone.
Yeah.
Yeah, but
Okay.
I think I have to like try to, we call it
Pull them
titrate.
back a little.
Titrate, yeah. I mean,
Sorry, what did you say it was called?
like titrate.
Titrate.
Titrate, like
Ah,
chemical.
okay.
Yeah.
Yep.
So it's like, not jumping right in, but like
Mm.
touching on it a little and coming back to the present moment, because like it can be overwhelming for the person if they go
Yeah.
straight into it without the sense of grounding and stabilizing, and also feeling like they can trust me, right? Because like they also just met me. So sometimes when it goes too fast, and then like I don't see them again after the
Yeah.
first session. But yeah, but sometimes I have to come in and like, hey, can we pause for a moment? And but sometimes that can also be annoying to the client, because they're like, I just want to talk.
Just want to get it out. Yeah.
Yeah, so it's a balance. It's a balance about how much to go into it and come back to the present moment, and to like make sure you're well resourced. Yeah, so I mean, back to your question about what do we do in the first session. So
Mm.
it's kind of like an introduction. And I like to I would say you can either talk, or you can use the art materials to tell me about yourself.
Mm.
Yeah,
Okay.
so I like to ask like, what are some of your hobbies, and what are some of your resources, like like exercising, or like maybe going out in nature, some of those things. And sometimes using collage is a good way to start, like magazine images. So
Okay.
yeah, if they don't know what to draw or paint, because it can be a bit intimidating.
Yes.
So that would be a easy way to start. So like cutting images that you like and pasting them. So I get a visual sense of, what you like, and
Mm.
uh, what interests you as a person. Yeah.
Oh wow. Yeah, that sounds like a much more well-rounded way of looking, at healing. On that, so you say you can cut things out of magazines. So what kind of different arts and crafts can people do? Like, obviously it's not just painting, which everyone tends to think when you're doing art. People just automatically jump to that. What do you offer? What do you help people with?
Yeah, so let's start with the simple, easily available art materials, things like color pencils,
Hmm.
crayons, pencil, these and markers. Like
Hmm.
these are some of the things that are easier to control,
Yeah.
because they're dry materials. So it's easy for people who feel like, oh, I want to have more control, so they will use the dry materials.
Mm.
And then for the wet materials, they are more like expressive. Maybe it's good for expressing emotions, like painting, watercolor, gouache, or also known as poster color,
Okay.
acrylics. Um, but for painting, some people feel like, oh, I'm losing control. So
Oh,
it is,
really?
yeah, because like some people, especially like like anxiety, and
Yeah.
sometimes they need to have a sense of control. But sometimes slowly
Um,
introducing these wet materials can help a person feel more comfortable with uncertainty. So they might start off with dry materials, and then
mm.
move towards different media like wet materials.
Okay, so sort of in that situation, would it be true to say, that some people with anxiety, it might be that when they're using paints, they're worried because it's more permanent. You can't kind of, if you feel like you made a mistake, it's harder to correct. Is that what you mean?
Yeah, possibly like maybe with pencil you can erase it. So like some people
Mm,
might
mm.
might want to use the eraser a lot.
Yeah.
But apart from permanence, there's also things like, spillage and messes.
Okay, yeah.
And
Yep.
on the other end of the spectrum, we have like plasticine, clay,
Clay. Yeah.
like modeling clay. We have the dry one, and then we have the wet clay.
Okay.
So the wet clay can be a bit overstimulating and activating. It can bring up a lot of subconscious trauma. So we try not to use the wet clay in the first few sessions, but maybe later on when the person is more used to the therapy and has more resources, then we might suggest trying the wet clay.
Yeah. Okay. Because it's with I used clay when I was at school, and there's a lot more to it. You've got a lot more feeling and textures, and sometimes I can see you'd feel connected to the clay that you're keeping. And a lot of people, when they there's things like tree therapy where you're looking at grounding and soil and things like that. So I think it probably is a little bit similar there. So that could be why it's a bit more challenging.
Yeah, I mean it's very like sensorial, and it's hard to control like the clay. I mean, when it's wet, it can be very hard to mold. It has to be like just the right amount of wet and dry for it to be molded properly. And if we're not used to working with clay, it can be hard to work with. I think what you said about the nature and grounding, I mean it's also very physical. It's very like solid. I mean, it's kind of different, I think, because clay is it's like an art material, and it can get very slippery and so I guess the nature equivalent would be like maybe mud. Like soil
messy and difficult to work with. So sometimes it's not going to turn out how you like. And for people that might have a bit of obsession around things being correct or being afraid of failure, I could see that could be a real challenge.
If you go with like the mud, so maybe it would be good to start with just like a park, like a more neat and tidy like form of nature, like a park, or like just walking on the grass with your shoes on, like instead of walking barefoot, for example.
That's interesting. Very cool. I know we're getting a bit close to time. Is there anything that any last minute things that you would like to share with people? Maybe some words of encouragement for newly diagnosed people with either trauma or with neurodivergence.
I think it's important. It's just like, remember that it's a journey, and you will not stay. If you're in a very low place right now, you will not stay in that low place forever, and things will get better. And I just hope that you can people can like look at what are the resources and what are the things that can uplift them, and just have faith and hope that things will get better. And it's important to also remember that your journey is your own, and it doesn't have to look like anyone else's. It's also important to recognize that I'm not the cure, like, so I'm just one of the resources that can help.